we talk about capacity, some of it is physical, but it is all the doctors and the nurses and the folks that wrap around that. And then it's also the equipment that they need to do the job. So there are many components to upping our ability to treat someone. And so we have a whole team that's working on this staffing workforce issue, and there's a couple different avenues in it. Some of it, when I talk to you more in the days to come about how we're sort of creating these zones in our state, we're doing that around the big cities. So it's Cleveland is going to be sort of one area across the northern part of our state. There's the middle area and more southern. And in some places, in one zone, they've tried some things. Like in one zone, they're already doing online trainings to help take nursing students or nurses who have been doing other kinds of work or patient care assistants and training them for a new job, or training a surgeon how they might become able to do some nursing things. So some of those innovations that one area of our state has already discovered, one of the things I'm doing is trying to universalize that or share the best practices that one place is using or anywhere in this country. So we have a group of people that are feeding that into those healthcare systems. Then we're also looking at things like what our state medical board can do, whether we need to make any waivers. We're also graduating classes early, so there's in some areas of the state I've heard that the deans who are now all talking collectively, that's my job, is get them all talk and then go out and take their innovation to each other. They're looking at graduating classes early so those folks can be deployed on the front lines. So there's a lot of moving pieces to the people problem. And it's not just for our hospitals. We are actually working with earlier year med students and nursing students to get them to be amateur disease detectives. We're actually building a curriculum for them to be trained in, because we know part of the way of getting out of this is going to have 5 components, which I'd be glad to talk about as well. We know that to get out of this, we're going to have a bunch of things in place. And one of them, once we have that testing, where we can be testing much more of the population, we're actually going to have to go back to the basics that we did in the beginning, which is extensive identification of somebody who's infected and contact tracing. And we're going to actually need literally boots on the ground folks, far beyond anything public health has even had on their payrolls, to be able to do that and do that as quickly as possible. So we're designing a new workforce that's never existed, and it'll be a wonderful learning opportunity for all of those. I mean, the people who are training in healthcare today, this is going to be a memory, a turning point in their careers. So all of that is underway, and I'll tell you more and more of sort of those innovations as they occur, because everything is moving.